Hello, my name's Maree Kirk and I'd like to talk to you today about the supporting teaching practice for students with learning disability and Down syndrome, a capability model to support the education of students in the regular schools. In New Zealand, there has been education policy to identify education goals for targets for specific child population groups. One of those is students with a disability. Special education services set policy and strategic goals to achieve inclusive practice since 2010. Special education was renamed Learning Support in 2016. Children with a disability make up 15% of students in our regular schools. There's increasing evidence, however, of the persistent gap in education policy and provision for students with Down syndrome and learning disability. As we know, quality public education is a human right and a state responsibility. The purpose of this study is to address the gap in our understanding of capability and human rights and well-being for children with a disability. The particular focus is on the education sector. The capability model was first piloted with the Ministry of Education in 2014 and 2016 with 156 participants and 42 schools. The model has been run nationally since then, and what I'm bringing you today is the results of the current year, 2020 and 2021. The capability model of wellbeing informs the professional learning and development program. The program is run as a series of seminars for professional development that are linked to the New Zealand curriculum, so cover literacy, numeracy, ICT skills, the individual education program, social skills, and inclusive practice within the school program across the school management. School visits are used to discuss teaching practice and how the teachers are getting on within the program and utilising that within the school. Visual sociology is used to reflect on teachers' practice themselves and to reflect and assess the students' progress and achievement within the classroom and school environment. The design of the program includes teachers attending the seminars with families, allied health professionals, and service providers that come into the school and work with the school teams. Generally, 12 to 14 schools attend from each region. That can vary at times up to 16 schools working together. Prior to 2020, there's been over 60 schools that have attended the program nationally. The school students with Down syndrome and intellectual disability have been of mixed ethnicity and have been aged from 5 to 21 years. This means that the schools have been primary and secondary schools. The adult participants involved have been teachers, classroom teachers, subject teachers, SENCOs, special education needs coordinators, specialist teachers working only with the student with Down syndrome on one-on-one time, and health staff attached to the school, special education advisors, and parents of the students with Down syndrome. All of the students in the study are OARS funded students, which means ongoing resourcing scheme in New Zealand. They receive government funding for their school years. In 2020, there were 471 adult participants within the program. Education, as I've explained, health providers, which may include your speech language therapist, your behavioural therapist, and the parents of the student with Down syndrome, some of whom were grandparents or siblings. They came from 32 regular schools and identified that the inclusive practice across the schools around New Zealand was very variable. In the photos on the screen, it shows the teachers involved in the program, and the middle photo shows a school visit of the teachers' implementation of utilising the resources within the classroom environment. On the screen now is the findings from the 2021 program and the importance of the facilitator's knowledge. What we do know is that often, particularly for students with learning disability or intellectual disability and Down syndrome, professional development programs are often provided by parent groups or Down syndrome organisations directed by parent groups. And it's very important that the quality assurance of these programs and the quality assurance and criteria of the facilitators is well checked by the groups. So it's important that the feedback was that the facilitator knowledge was sound and credible for the educators within the course and suitable and credible for the parents who were attending the course. The people wanted to return to the professional development course due to the facilitator knowledge. The facilitators were able to answer the questions from the participants on the floor, or were able to say they could return to the PLD with research provided answers and interactive responses to the attendees on the course. The facilitator knowledge was a key driver for the attendees returning to the program. They felt confident that the course provision was engaging because the facilitators knew what they were talking about. Motivation to continue in a year-long program was very important to assess. Returning to the program over this course of time allowed the participants to build relationships, knowledge and skills across the regional group. It also enabled the participants to build confidence to practice with the resources and practice discussing the strategies they were using with the children and young people with Down syndrome and intellectual disability within their families, within their schools, or within their community groups. This allowed them to build capability with the child at school, at home, and in the community. It enabled them to share ideas and share different approaches. And this was what motivated them to continue within the program across the year. And it showed in the results a high motivation where they strongly agreed to continue to want to come back to the program and continue within another program of the similar way over a next year. The participants found that the material was very worthwhile to what they were doing here and now in their daily life and daily practice. This was very relevant in that sometimes professional learning and development fails to bring theory to life, so that the participants found it was meaningful to the people that attended, and the strategies were based on things that they could embed into their day-to-day life and into their day-to-day teaching practice. Strategies could work in the classroom and the strategies could work at home, so that the teams working with the child felt that they were making progress together. It also allowed a discussion space for the team at school and the family to decide on what strategies and approaches were best suited for the way that group of people worked with the child and their attitudes and beliefs around how they wanted that child to move forward. Next, we looked at the professional quality of the program. The quality was vital in that it was current It was research-based, and there was evidence that it was linked to the current New Zealand practice and to the cultural significance for the people within the course. The speakers came across the program were regionally accessible to the people within the course. They could build regional contacts, and for the parents and the teachers and the health professionals, they were able then to speak to the guest speakers after the program. The holistic approach of having parents, teachers and allied staff work together to build capability was very important, that they were working with the child central to how they were developing their own skills and their own knowledge base. All the seminars worked on an inclusive approach, working to learning about the child's development, but also then reflecting on their own development of skills and knowledge around how to work best together and how to gain their own knowledge and skills about children with Down syndrome and learning disability. The results were then looked at against earlier evaluative findings for the supporting teaching practice program that had been run over earlier years, and there seemed to be a consistent trend with the supporting teaching practice studies. The participants reported an increased level of confidence and knowledge for the parents. They reported an increased level of skill and ability to access resources. Particularly, this was reported highly for the teachers, who found they were often time pressured to go through many avenues of where to find resources that worked well for them within the classroom. Focus groups showed that school participants highly valued the improved level of knowledge and skills when they worked together as a team and taking that time out to support the students with Down syndrome and plan and organise the curriculum learning going forward. The focus groups also showed having that time working collaboratively with the family reduced tensions within the school, where the families and the teachers could work together and better understand the overall home and school situation and what worked well for the child. Parents reported a much greater understanding of how the school process worked and really improved a better school relationship and sorted out the communication times with the classroom teacher and the special education needs coordinator within the school. The perspectives and increased knowledge across the team working with the child and accessing that information that was relevant to where the student was learning at the time increased the relationships and the knowledge across all of those who were working with the child in an incremental way throughout the year and built their confidence in continuing to access resources and improve their skills and strategies for working with the children and young people with Down syndrome and learning disability, and then the broader student group. Overall, the findings were significant, and there was an improvement in the teacher's skill, confidence and knowledge of policy around inclusive practice and how to access resources and learning strategies for students with Down syndrome and learning disability. The major themes was the increased knowledge of how to gain this access to information and resources. It's very important that these steps to facilitate how to access information and research-based information that we know works well, that classroom teachers and families are given support to do this process. The key finding that the awareness that children and young people with Down syndrome are capable learners that can achieve and expectations need to be high was very important. And the increased awareness of the ability of children with Down syndrome to achieve within the regular learning environment was a very positive outcome of the program. And an awareness of disability rights and child rights was an important process throughout the year-long course. The holistic approach to professional development, where the teachers and families learn together, was a huge benefit in the home and school relationship and taking a holistic look at child development and the student with Down syndrome within the school community. The third major theme was the benefit of the insights gained and shared through the parents and the schools learning together. The personality and individuality of the young child, their social skills and ability within collaborative learning, and the unique way that the student learnt and passed those skills on within the student group were very important aspects that then built towards the student's achievement. As the program has been running for several years, these skills were built on as the students have grown and the schools and parents have returned to successive courses and continued to work side by side with teachers and these approaches to developing capability for children and young people with Down syndrome. The human right to education is the opportunity to learn and build capability across all learning contexts in the regular school, to ensure that each child with learning disability and Down syndrome continues to have that opportunity to learn and take that opportunity from adults around them to ensure that in each context the supports are in place when necessary to make the most benefit of that learning environment. Intentional provision of professional development programs is essential to be an influencing factor in quality public education for students with intellectual disability and Down syndrome. Here's a slide that shows some of the visual sociology from the schools within the study, working within the classroom and putting in place some of the strategies for the children and young people with Down syndrome within the early years and in the senior years as they transition to work experience. The implication for ensuring an intentional professional development program is in place is to promote well-being for children with intellectual disability and Down syndrome is state-funded and required to ensure that evidence-based explicit teaching strategies and resources are used to provide all opportunities to build capability for children with a disability in the natural child environments of regular school. Planned time for specific teacher training for inclusive practice within the school and across school is essential to build family and professional capability to support children's well-being. Professional development that takes place in a child-centred approach and research evidence for children with a disability in regular schools builds well-being, positive life outcomes, and aligns with the Convention of Rights for Persons with Disabilities for children and young people with Down syndrome. Thank you very much. Thank you to all of my participants within the Supporting Practice program, and thank you all at the conference. Thank you to my sponsors, and there's my details. Thank you.